Namaste, I am Dr. Asha Baxi, Lead Consultant at Motherhood Hospital, Indore and Secretary General ISAR 2024 to 2026. We have many questions in the field of infertility, and these questions will be answered by our ISAR members from all over India. So friends, let's begin micro-learning in infertility. My question is, in today's era of antagonist protocol, is there still any role of long agonist protocol or is it extinct? This question will be answered by Dr. Jatin Shah, who is one of the very famous infertility practitioner, very knowledgeable and gives very practical tips about day-to-day practice in infertility. And besides that, he is a very good photographer and a fitness freak also. So over to Dr. Jatin Shah.
Hi friends, the question today is that is there any place for the long agonist protocol in ovarian stimulation for IVF? With the short antagonist protocol, when you begin stimulation on day 2 or day 3, you often find that one follicle races ahead and becomes a dominant follicle, and on day 7 you have an asynchronous cohort. Now even if you do some form of pre-treatment like luteal estradiol or 3 days of antagonist on days 2, 3 and 4 or a short-term course of birth control pills, still very often you find that the cohort is not very synchronous and you get fewer oocytes and fewer top quality embryos. Also in these times where we like to do fresh transfers, especially for some poor responders who have less than 10 oocytes or women of advanced maternal age, we find that the endometrial receptivity in an antagonist protocol is probably not as good as with the long agonist protocol. So the long agonist protocol has the advantage of giving you perfect follicular synchrony. It also ensures that you get more oocytes and more embryos, which is the reason that in high responders we used to get hyperstimulation and therefore we abandoned the use of the agonist, and that was correctly so. We also get oocytes with better morphology, you get zygotes with better morphology, and numerous studies have shown that fresh embryo transfer rates with the agonist are far superior to those with the antagonist. Also, you have such perfect and beautiful follicular synchrony that you will get a greater crop of metaphase 2s and therefore more embryos for more FET transfers and giving you a higher cumulative live birth rate. Also, some poor responders are prone to premature LH surges and premature rupture of follicles before you can give the trigger, which is completely abolished with the long agonist. Critics say that with the long agonist there is over suppression, and how can you over suppress an already suppressed hypothalamo-pituitary ovarian axis? The trick here is then to begin stimulation not with FSH alone, but to use a combination of FSH and LH, or rather just use HMG so as to counter this over suppression of LH. To my mind, we need to be totally individualized in our approach to IVF, and there is still a major role for the agonist, especially in poor responders and some normal responders where you have noticed severe follicular asynchrony being the cause of the failure of the IVF cycle. Thank you, friends.
Thank you very much for an excellent answer, and I'm sure it is going to be helpful for lots of our colleagues. I take this opportunity to request you all to support me wholeheartedly for the upcoming election of second Vice President ISAR from the year 2026 to 2028. Thank you very much.